someone who's that good is given 30 years, is not going to help you that easy. But if you do, any clinician out there, and including yourself as well, Lawrence, you will notice that when you see someone's passion and drive for it, and you genuinely notice it, that he's genuinely trying, no clinician will be out there and say, I won't. They always will, and they always do.
The CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Hi CPD Junkie fam, I'm your host Dr Laurence Doan. Today we're joined by Dr Murtaza Mak. He graduated in 2012 from Pakistan and after passing the ADC in 2019, moved to Canberra. He is a general dentist based in Australia who believes in spreading smiles and the knowledge behind tools, techniques, and theories, and he continues to help young dentists around the globe in their mission to spread smiles. He's a founder and principal trainer at ADC Online School, Dr Mak Dental Academy, helping dentists and dental students around the globe. He says, chase your passion one day at a time. Dr Mak, welcome to the show.
Thank you. Thanks for having me.
So tell us about your dental or CPD journey so far.
To be honest, for me, it was all about, there was a lot of weight initially when I first moved to Australia. There was like passing the ADC exam first. So it was a lot of pause for me because I couldn't practice dentistry for a while. And then when I started in 2019, I literally wanted to do as much as I can and I could. So it's been pretty good, I must say, because there are times when you couldn't do what you really like, and when you get the gift again, you just want to do as much as possible. So that's what I've been doing past 3.5, 4 years. Yes.
Yeah. So tell me about it. So you graduated in 2012. You're working out in Pakistan for a little bit. Then you decide to make the move. So, how was that initially, and what kind of encouraged you to make the move?
See, initially when I was working when I finished graduation, I did my 1-year clinical training in a hospital with the oral maxillofacial and the support staff as well. So that 1-year clinical training in the hospital, working with the max specs, I was like, this is something I would love to do. And I would love to not just do it on a small scale. I would love to just make myself recognized around the globe. So, then I started looking at options. Where can I go? Can I go US, Australia, Canada, UK? Can I go to Norway? So I started looking all the options. And at that time, one of my brothers was in Melbourne, and he was like, try Australia, you might actually like it. So then I started applying for my master's initially, and so got into public health, came here, and then with time, my passion changed from oral surgery, max specs, more towards cosmetic side for a lot of reasons. So now I really enjoy cosmetic dentistry, but I think it was just that there's time when you just want to, see yourself and grow yourself as a clinician, and you plan that, where you want to see yourself in the next 10, 15, 20 years. And I think that led me to my journey coming to Australia. I would say that.
Yeah. And how was that journey? So how was that journey transitioning to Australia?
See, I'll be very honest. It was really difficult because initially when I came, I wanted to, work in the dental industry as well, because I wanted to get more experience how things work in Australia. Because I feel like every country might be a bit different. So I started working as a dental assistant. And then because I had to do my master's as well, so I was doing that. And then I wanted to do ADC exams preparation as well. So I was trying to tackle 3 things at the same time. Some days they're quite overwhelming. Some days I was like, okay, is it going to happen? Is it not going to happen? But then slowly, I think you get a hang of it. You make your way up. And once I passed the part 1 written exam, that's the time I was like, okay, now there is possibility. Things are happening. That's the time I finished my master's as well, 2018. So I was like, okay, now let's focus only on part two and clinical. At that time, I think I worked 2 years as a dental assistant, and that was amazing experience because you can see the dental procedures, you are assisting the dentist, especially depends which one or who you're working with. I was working with quite a senior dentist. She was 41 years experience in Jindali, Brisbane, Morella Herman. She was such an amazing clinician. All her experience, I gained so much. 2 years with her, 2.5 years. Then I got an opportunity working as a practice manager at another place up north in near Sunshine Coast. I was like, okay, let's learn something new. So making my way, I felt like it would have just passed the exam and have started working as a dentist. I felt like my understanding or my dental journey would have been a bit different. But because I went learning all the different areas, how the dental industry and how things work in a dental clinic, I felt like I became a better clinician in terms of learning all the aspects. And now when I look my journey, I feel like I'm glad this happened to this level. So it was tough, but it's good now. It's done, and that's every day when I feel like I should do more is because of the same time when the 5 years I couldn't work as a dentist in Australia when I was here. So now when I'm doing any CPD or any course, it's just the passion has to get ignited from that point when I was not working.
Right. Well, I mean, like, talk to me. So when you're assisting and you're learning from this clinician, was she just a general dentist? Was she doing more of the things that, was similar to what you kind of wanted to do in the future? Like, how did you kind of go about? Was there a particular thing there or?
With that dentist, first she was she was 41 years experience, and with her dental sort of because everyone has its own way of doing dentistry. Her way was that she was a perfectionist, and that's what I learned from her. So even if it's 90% good and she feels it's not 100%, she's going to repeat the whole procedure. So learning from her was amazing. And she was not specialized in one area. She has done multiple courses. So she was working all sort of general dentistry. She did a lot of courses. I think she did M. Clinton from the University of London for orthodontics. She was a fellow of the American Academy of Cosmetic Dentistry. So she was doing that. She did multiple diplomas in periodontology, implantology. So when I used to work with her, even TMJ at that point, all the NITA and all those things works. The thing was that looking at all those things and treating a patient as a whole was just, learning dentistry on a whole new level. Because I feel like when we only focus on one area, just the overall perception of treating a patient is very different to someone who knows everything and then they prefer to treat one side of dentistry, if it makes sense.
Yeah. They have an undue bias towards this particular type of treatment because they are unaware of the other stuff.
Absolutely. And even with the treatment planning process, and I'm not sure if you agree with me, Lawrence, but what I have seen and what I've learned since I graduated in 2012, the treatment planning process is that one thing that if all of us clinicians learn, treatment part is, once you've planned it, the treatment part, if you cannot do, someone else can do it. But the most important part in dentistry is if you can plan the case, if you planned it well, and you exactly know what needs to be done on that patient, you already solved the case straight away. Rather than, beating around the bush, let's do this, let's do that. And then the patients keep coming back every 6 months, 12 months with a broken tooth because the problem was not assessed in the first place. Or maybe we were not quite upfront telling them that you have other underlying issues that need to be sorted as well. So I think from the first get-go when I started with her, the way she was treatment planning every single case, even if someone was coming with a toothache, she used to do whole examination, whole photos, whole assessment. She was like, okay, we'll fix this tooth, but you have all these other aspects or all these other underlying issues happening as well. So then we were making plans for everything. So when you start seeing snoring problems to TMJ problems, from normal fillings to orthodontic problems and, perio issues as a whole in every single case, I feel like your dentistry already uplifts at that point.
I see what you're saying. So I want to dive back. So you're at this point, you're being assisting, okay? You're observing this dentist who's all about hitting that execution, that perfection. Otherwise, she's going to redo it, yeah. And you're learning and watching, right? Meanwhile, you're like, okay, I'm applying for ADC. I'm trying to do these exams. I mean, there wasn't a Dr Mak Dental Academy beforehand. So how did you kind of go about, building up towards, passing? How did you find that journey amongst all of that?
Yeah, see, with the ADC Part 2 exam, especially the clinical exam, the pass rate is roughly below 5%. So if there's a batch of 30 people, there are 2 or 3 people passing out of the 30 in one city. Now, when I was training for the Part 2, I realized either there was not much help available, or if the help was available, maybe the candidates were not guided in the right direction. So when I was doing it, I felt like, I wish someone would have told me the technique that I learned now to be able to help other people, so clinicians. So when they're with their stressful journey, then, working as well, maybe doing their masters as well, and then doing the ADC, they guided in the right direction. So when I passed after 5 years, I thought that all my knowledge that I've learned, why let it go to waste? So it initially started with the YouTube channel. I just started sharing my knowledge, what I've learned. This is what you should do, from crown preps to a simple putty technique to making a provisional crown. And then, how to actually trim that putty to have a nice margins out of a provisional crown. All those basic elements, how to assess your crown prep. And then slowly, so many people started messaging me that herbal folk helped us so much and this. And I was like, okay, why not, just give back as well? Because I exactly know what ADC people feel, because I've done that journey. Otherwise, it might be difficult for me to feel that way. So that's the time I started teaching. And then initially what I did was I was flying to Brisbane, Sydney, Melbourne, and I was just doing the 3 days teaching assessments and technical sessions, and I used to fly back. But then when COVID hit, it was just like, it's difficult. People can't even come to Australia, or they can't leave, or they can't travel to a different city to learn. That's the time I was like, why not record all the knowledge I have? Everyone is at home. I already have my mannequin and the setup that I never sold, because I was like, you're going to keep practicing on it. So then I recorded around 100 videos. Took me like 3 months, recorded all those 100 videos, every angle, every anything. Then I started giving out. And that's how this ADC Online School started. And later what I realized was, it's not just with the ADC students, because how they're judging them on the functional basics, on the functional criteria, is something that I call, which is a social media trap. Because we see amazing clinicians sharing amazing work all the time on social media, and we get overwhelmed. But at the same time, if you look at the functional part, what a dental student needs, they don't need those fine margins around the crown. They need functional basics on the composite. They need to have the contact, no excess, no overhang, cusp location, cusp height, all those basic elements. Same as we're doing a crown, if you don't have enough reduction and you're just worried about how nicely flush the margins are, you won't have enough thickness on the porcelain. So just understanding the basic foundation of the principles, I realized that the dental students can get great benefit out of this as well. And that's what the ADC is basically asking you, the same criteria of a fresh graduate when they come out. They should have the same understanding as they have. So then I did the online, and I started giving content out to dental students, and then they started actually getting benefit. And that's what they tell me now, that, with that composite technique and crown prep technique, with the bench test exams that we were just, lacking the skills. Now we've actually started to understand, yes, my crown doesn't look that great, but I have actually passed it because now I understand that that's not the most important element. The other things are, which are the functional side and dentistry.
So you mentioned that, after you passed it, you started doing your own courses, like not doing your own courses, but you started to learn and attend other courses. What kind of courses were you attending at that time?
See, initially, to be honest, I was attending whatever was there.
Mm-hmm.
I started from 2 days courses, to 3 days courses, to weekend courses, or whatever was available, any online content. And from the start, since 2015, I realized that, you search for the content, there's so much content out there. Even if I say YouTube, there's so many clinicians, they have lecture series, like 10-hour lecture series, 5-hour lecture series. They have shared so much information in terms of root canals, extractions, basic understanding on prosthodontic principles. So many different pages. I was like, okay, if I see one video a day, let's see how much. So since 2015, that's my pack, that I will watch one video a day. And once I finished, I felt like, okay, let's first see the maximum I can gain from YouTube, because there's so many videos that I think so many people haven't even explored yet. So YouTube, I felt like I just went crazy on. And so many videos keep reviewing, people like sharing their cases. And then whatever the courses were available, initially I was like, okay, let's get all the concepts of general dentistry. Let's get whatever's available. And then I will start to see that, okay, this is my goal plan, where I want to see myself in the next 5-10 years. And this is how I'm going to plan my journey. Because I feel like initially, if you really like something, and after a while, if I don't like something, then I would have done the ADC exams in the first place. So I was like, if you really like something, you need to make a plan, even for yourself. But that's my treatment plan for my career. I was like, okay, let's map it out. Let's write all the points down. Which areas do you like? Which areas you don't like? Now, I personally believe that even if you don't like an area in the industry, it's still good to learn that. Because until and unless you don't learn it, sooner or later, the area you don't like is going to come in terms of one patient, and that's going to, hamper your diagnosis of the final plan that you make. So learning everything, but then mapping out where my journey is heading and where I want to see myself. So then slowly, I kept changing the CPDs to where I felt I wanted to learn. At the same time, initially when I started doing CPDs, I realized that the 2-day CPDs and 3-day CPDs are amazing, but I felt like to learn something properly, I might do like a longer course, like a proper diploma, like maybe 9 months, 12 months. So just get an understanding a bit more properly, rather than doing it 2 days. And there's so many amazing clinicians. I've done so many amazing 2 days courses that you do, and you come back and you actually feel like you've uplifted your skills quite a bit. But then at the same time, I felt like, especially when it comes to ortho and implants and all those factors like perio, I was like, it's better to do a long course to make sure we get the best understanding out of it so I can give maximum back to my patients.
Yeah. I want to dive in because there's so many things to unpack here right now, right? So a lot of our listeners are, recent graduates, and they're coming out, they're coming out with a lot of debt. So they're like, oh my God, but there's so much I want to learn, You mentioned YouTube, so there's, like you said, so many different YouTube content out there, so many different people to learn from. But how do I go about deciding this is the person who I should be listening to versus, this content isn't quite up to scratch?
See, what I've seen is, and I always say that every clinician is amazing. Every clinician has its own way of doing things, and he's doing amazing in its own way. The only thing that varies from person to person is I may understand one person differently, and I feel like I can understand their skills and their mentality and their philosophy suits my philosophy a lot better than the other person. So that way, I would say if someone has 100 videos on YouTube, you just watch one video, and sometimes it's the way they explain, it's the way they share their knowledge. It's just, you can grasp that. And you'd be like, okay, this is one person that I would love to, learn more from. Like we have, for example, the Dental Minute. I think most of us must have heard about it. Dental Minute, there's Dr. Stephen Cuthbert. He shares his 40 years of dental knowledge, and he has almost 100 plus videos, from how to give a painless local anesthesia to how to do a veneer prep, how to check the shade matching, how to do a normal extraction, when can you decide to do a bone graft, when should we section the tooth. And these are the basic elements: how to do a partial denture, how to do a removable and fixed, how do you differentiate. These are the basic elements that we all see on a clinical practice as soon as we graduate. How to do a predictable filling. And from painless anesthetic to doing an implant, if so much information is out there, I feel like, yes, it's the same information, but some people are, explaining it differently, so you might understand it better. At the same time, if I explain this information, 10 people might say that, oh, this information was so good, because maybe they connected with me differently, rather than other 10 people might say that I didn't understand that well. It was not a bad content, but the reason they did not understand me, maybe they did not connect with me that way, or maybe my understanding or the way I was explaining. And that's why it's so important when we're picking CPDs. These days, you notice everybody has a social media account. Most of the clinicians have it. They have their, content out there that you can listen. So when I generally go to someone's YouTube channel, I generally open 1 or 2 videos, listen to those videos, carefully, no judging there, or, not big judgment or anything, and actually see. And majority of the time, if their 2 videos have connected with me so strongly, I'm very sure the other 100 would as well. And you don't have to do anything. You can learn all those skills. Because, there's one thing a lot of people ask me that, what's the most, that one CPD you did and you regretted, you wish you didn't spend money on. And I always tell them there's not even a single one. Because yes, there was a course I went and I felt like I already knew 80% or 85% of what the person was telling me, but I still gained that 15%, which makes a lot of difference. Every composite course you go to, every crown prep course you go to, every implant course you go to, yes, maybe this 70% is same information, but that 30% is what differentiates one clinician to another, because they are putting their own twist to that procedure. And what happens is certain times you follow one technique and it's not suiting your hand skills. As soon as that 15% adds to your skills, you feel like now the same 70% is utilized a lot better, because that next person that you did a course with, he gave his own twist to his technique, and that technique is actually suiting your hand skills and your handwork a lot better than the other clinician. Doesn't mean both were wrong or both were right. It's just, how we say this, all set of teeth are different, the same way all clinicians are different. We connect with one person differently than another.
Yeah, I think that's a great way to look at it. I mean, another point that you mentioned a lot earlier was, ortho implants, because a lot of graduates come out and they're like, I want to learn ortho, I want to learn implants, I'm going to do it all together, Talk to me about how you kind of went about that process.
So for me, and I have to give credit to Dr. Rubenstein, because I saw one of his videos, and I think he did veneers, and the patient was crying at the chair, and you see the amount of emotions involved with doing a smile makeover, changing someone's smile. It's just not physical, it just changes their whole personality. And I was like, for me to become a maxillofacial, it's amazing, but then when I started researching about it and how many years you need to give, and I don't mind giving 15 years. The only thing is, am I going to still be linked with dentistry or not? That's the point. I was like, okay, maybe with maxillofacial, I might be out of dentistry. So before I do that, why not explore the areas which are within dentistry to make sure, do I actually enjoy something? Or should I actually just start my MBBS now and do the 5 years of MBBS and then you do the 5 years of maxillofacial after getting here, so another 10 years. Or is there any area that you might actually enjoy more? Let's explore those. So when I explored the cosmetic side of it, I was like, okay, this is something I would like to see if I develop a passion for it or not, because when it comes to that emotional side of dentistry and the functional side of dentistry, if you combine it, actually creates an amazing mix. So I, again, planned it. I write it down, say, okay, let's look at cosmetic dentistry, what's involved with it. And initially, I think when we do, for example, we're looking at veneer cases and full mouth crowns, we're just looking at crowns. We're like, okay, I learned veneers on the weekend course, and I will start doing amazing courses, amazing cases now. But then when you start doing cases and you start looking at all the restorative cases, every single case needs perio. Every single needs concept of orthodontics, because we are coming towards minimal invasive dentistry. Are the teeth aligned at the right time or not? At the right place or not? Do you want to move the teeth first? Then comes to prosto, which you need to know what type of restoration do you want to do. Is it direct? Is it no prep? Is it indirect? Then comes to functional dentistry. Because if you don't know your functional dentistry, then even if you do amazing veneer, they're not going to last, because the patient is going to break it because he didn't respect either the jaw problem or the bite. So I felt like if I need to do cosmetic dentistry, and that research took me 12 months because I wanted to assess. It's not like I will do a weekend research. I was like, okay, let's look at all the people who are doing cosmetic dentistry. I used to take screenshot of their work before and afterward. I used to map it out with a pencil. This is what they did. And initially, there's no one to guide you, but I always say that, if you take photos and just sit down on a Sunday when you have nothing else to do or you're not stuck at anything else, and just look at the photos. It teaches you so much. Just look at the photos, what the other clinician did, and you start to realize, actually, they did the gums as well. Otherwise, the proportion would have not looked right. I think what they have done is they've moved the lower teeth as well. I feel like they've actually widened the arch as well. And then initially you don't realize, but then you look at the second case, the third case, fourth case. And then you go to another clinician's work, third clinician's work, fourth clinician's work. Take the screenshots, print them out, map it out. So first 12 months, I kept on doing that. I was like, okay, this. Then you start to realize that if I actually want to do cosmetic dentistry, or if I really want to do good work, then I need to understand perio, ortho, prosto, functional dentistry. Until and unless I don't understand these 4 principles, only then I can combine it and say I can do cosmetic dentistry. Because if I don't, then every second case, now I feel like need gum contouring. Without ortho, you might not say that this is predictable long term. Otherwise, I have to openly tell the patient I have to drill this much tooth. And as soon as you show it to them, they actually say, actually, I'll do ortho. But the problem there is, again, that for me to say, learn perio, ortho, prosto, functional dentistry, and then do, it takes time. And then you have to say that, can I do implants, ortho, everything at the same time? Then you have to start thinking that, will you be able to do all that at such quick time with all the finances involved? Or should we just hold on and start with one thing at a time? That's where your planning involves again, where you say that, okay, this is my goal. Now I've developed within 12 months that this is an area I like, and I feel like I have a motivation and drive for. Now start looking at things. So the one thing that you can do is either you do courses or you find a mentor who does those cases, and they can teach you and guide you. Now, the problem is I have a detailed video as well, how to find a good mentor. But the thing is, if you find a good mentor, that is on a whole new scale now. Because every second day, you can sit down with them, even if it's 2 minutes every second day, that 2 minutes bulks up. And in the whole year, you will say that I've learned more than doing a weekend or 10 weekend courses, because consistency matters more. I personally believe in this, rather than, doing a lot in one weekend and then 4 weekends we're not doing anything. And that's the same thing I say, that every day you watch one video, even if it's a 3-minute video or a 5-minute video, it makes a lot of difference. So that's where I realized that, okay, I have to learn these 4 principles: perio, prosto, ortho, functional dentistry, to be able to do good cosmetic dentistry, or else I should not touch the patient because I'm being unfair to them. Now, one point that we need to understand is, again, the planning protocol. If I can't do ortho, doesn't mean I cannot plan the case. I can always say that, okay, this case, once you develop the understanding, requires some teeth moving at the right place, which is, again, digital smile designing, all the smile principles. Once you've learned it, you don't need to know ortho to be able to tell the patient that these teeth need to be moved. I will refer you to an orthodontist to be able to do that, for them to bring it back to me, so then I can do your veneers. Or, for example, I will send you to a periodontist first, then I will send you to an orthodontist first, so they can do the work, then I can do veneers. Or then we have to correct your bite issues first. That means either we are aligning the teeth or we are doing 20 teeth. So once you start planning the cases, I feel like that's the time. It's like you start to see patients differently, and that's the time you start understanding that, your area is which is the area you want to do. I know amazing clinicians who don't do implants, they don't do ortho, but they know when it's required. So they tell the patient everything. They still do the veneers, they still do the perio, but ortho and implant is done by someone else, but they don't tell the patient that, it's not required. So that's why all that things that started changing, I was like, let's do this, because of when I planned the 12 months, that, if I don't understand or learn about these 4 areas, that's a different topic. That if I want to do implants on the same patient in ortho, and I want to do everything, or someone else might do it, I can still focus on just one part, because majority of the time, it's really difficult for someone to do ortho, perio, implant, functional, and cosmetic, if it makes sense, right?
Yeah.
It's too much.
Yeah. So, I mean, how did you go about doing the learning? Because, okay, so let's start with perio. How did you kind of go into picking or learning about perio?
So again, I went mad on YouTube. I went mad on YouTube, and I was like, okay, let's find it. And, initially, even my colleagues tell me that I didn't find anything. And I was like, I have searched so much on Google and YouTube, and you don't realize how many free webinars were available on Google, that you type it. It was not on the first page. It was on the 11th page of Google search engine. And you find a webinar from an amazing periodontist who shared a 5 hours or a 4 hours lecture on explaining how you start assessing things and how you start treatment planning things. So start looking at that, start looking at different seminar cases, start looking at this. So I went 3 to 4 months on perio, and I felt like perio is very important. Then when I was starting my first job, because I was in Queensland, I was like, okay, I will start my new job in Gold Coast. I was about to sign the contract, but then I was looked at myself and I was like, okay, at that practice, it's a stunning practice. Do I have that mentorship there or not? Mm-hmm. Do I have that clinician who's going to help me grow to where I see in the next 15 years or not? So if that's not aligning with my goal, then is it good to stay in Gold Coast, or is there another place that might be better for me? That's the time I told them, okay, let's put it on pause, and I will let you know. I started applying all around. I still remember I applied 36 jobs. I did 36 interviews all around everywhere. And then I had a chat with my current principal dentist, and his goal was like, he did ADC as well, 15 years back. So he exactly knows how his journey was, and my journey can correlate with. He was doing dentistry over 25 years. He was a previous oral surgeon from India. So, and then he had 6 other clinicians, and all of them, one was 33 years experience, one was 16 years, one was 20 years, and one was doing ortho at this practice, one was doing perio, one was doing oral surgery, one was doing prosto, because they had all the specialization. And I was like, the 4 areas I want to learn, this practice gives me that. I know it's not easy. Nobody goes the first day and you tell them, teach me perio. They'd be like, why would I teach you? I've spent like 20 years learning that.
Yeah.
But slowly, if you're at a practice where things are happening, I feel like just watching a lot of stuff, and then you're doing your courses on the sidelines, makes so much of an amazing blend. So that's what I did. I looked at it, what I wanted to do, and I found the mentor that takes me on board. That initially 2-3 years will be difficult, because like Dr. Murtaza, and I've learned this the hard way, but I think it's important to learn that clinicians who are really difficult to work with are the clinicians who learn it. Mm-hmm. So you can't say that I want an amazing work-life balance and I want a great life at work, no stress at all, but then I want to learn as well, because when you have a less stressful work life, half of the time you're not getting that pressure, because someone who's that good is given 30 years, who's not going to help you that easy, right? He's not going to share his knowledge that easy until you actually work so much that you prove to him and justify to him that, I've done this as well. I'm still doing. You don't have to share your knowledge if you don't want to. But if you do, you can take me on the next level. And I can guarantee you one thing, any clinician out there, and including yourself as well, Lawrence, you will notice that when you see someone's passion and drive for it, and you genuinely notice it, that he's genuinely trying, no clinician will be out there and say, I won't. They always will, and they always do. Mm-hmm. But you just have to show their drive, and that's what I did. So the mentoring thing, that someone's there, was there at the back. So psychologically, I was like, I can get help from there as well. Then I was like, okay, let's find a course on ortho. Perio took me 3 to 4 months crazy on YouTube. Then I was like, I need someone to just assess and review in every case. And it's always a learning aspect. I see every time people say that, my videos are not very good. I was like, it takes you 100 cases to develop just the understanding. You can't say that I don't want to do bad work. Nobody wants to do bad work, right? Like tomorrow you go to the clinic, like, do you want to do a bad crown? Nobody wants to do a bad crown. Everybody wants to do perfect implant and everything. But initially, it's very difficult to do it right. Yes, you're trying your level best. And that's why we tell our clinicians that, or our patients, that at the same time, in my knowledge and based in my hands, I'm going to give you 200%. I can't become that godfather dentist, but, I'm going to give you 200% of my skills. And that's what I promise all my patients. Same thing, you can't have perfection on the first case. It's going to take you 50 cases or 100 cases to develop that skill, to be able to start understanding differently. So the failures are going to be part of it. If you're not getting failures, then I feel like either you're not worked enough. Like, how a lot of, I talk to clinicians and they tell me, I've never cut down a veneer or a crown. And I'm like, maybe you haven't done enough. That's what Lincoln Harris says as well, right? You haven't done enough. If someone says they haven't had failures, they haven't practiced dentistry now.
Yeah. So, I want to dive into it. So, yeah, obviously, ortho is another area that you're interested in, that you wanted to learn more about. And I know you've done a postgrad dip on it. How did you come about deciding that this is the one that you wanted to pick? And, how did you find it? Versus, and the same thing with implants. Like, that's another thing that you wanted to dive into as well. So,
So 2014, I still remember, I did a 6 months master dentistry course back in Pakistan. It was ortho, implants, prosto, and functional dentistry. It was just basics.
Sure.
So it was 6 months. We will do implant training, we'll do prosto training, we'll do ortho training, and we will also do functional dentistry training in which we're going to do cases. We're going to deliver, and they were prosthodontists or specialists training us. 6 months was amazing training. That's the time I realized that I don't like wires. Now, braces are amazing. What they do to the patients is amazing. Again, it's my personal preference. I have friends who do amazing cases, but I looked at them. I was like, I don't want to deal with the wire. It's my personal preference. I don't like brackets. I don't like wires. And then I looked at myself and I was like, okay, I want to do ortho, but I don't want wires because majority of the time I feel like until unless I don't do ortho, just to be able to finalize the case would be difficult, because if I completely rely on a different person, because tomorrow if I say I'm going to completely rely on this person, do your best job possible and send me back the case, you might not be happy with the final result, because they're not going to say the ortho was done nicely or badly, or it was done in a way that you're not happy with. They will just say that you placed final restorations. I'm not happy with it. So what do you do then? You can't blame the person you sent it to, right? Because they did the best job possible. That's what you asked them to. So I was like, okay, I need to have a good understanding first, and I don't like brackets and wires. So what should I do now? I was like, okay. And that time, clear aligners were out of the market. I saw the boss diploma, and then I was like, they teaching you good diploma on clear aligners. Maybe this is for me. And I had a chat. I still remember, and I always do that. Whichever diploma I want to do, I message them and I tell them I would like to talk to the coordinator or the person teaching it. I would like to spend time, just half an hour. I'm happy to come down if they want me to. I'm happy to drive to Sydney. I'm happy to fly to Melbourne. I would like to sit down with that person just for 5 minutes, 10 minutes, just for me to say that, can I connect with them or not? The same thing I said with the YouTube video. Because if I don't connect with them in the first 10 minutes, how can I do a 12-month diploma with them? Same thing as that. So I had a chat with boss. I had a chat with Dr. Vandana, Dr. B. And initially I was like, okay, even if I know the concept that I can do 30 to 40% cases, and then 60% I will rely on the orthodontist, it's okay. I don't mind. But at least I need to know some principles. And then I did that 12, 15 months course, and I felt like, really, really helped. Yes, I had some previous knowledge on orthodontics because, I've assisted a lot in the past. And yes, I did the 6 months. But still, I felt like, the clear aligner is a very different mechanics. The attachment you use and the clinch check, how to correct them, and, the principles are different. Some movements don't happen, and you don't see that initially when your lateral is not moving, and then you realize that, in the course of teaching you that, the attachments are completely wrong. These movements lag. 60% of that movement is not going to happen, so you overcorrect and things like that. So my ortho element was getting solved there. Implant, the only reason I wanted to do, and I'll be very honest, because I felt like I'm very focused on aesthetics. I feel like until and unless I don't learn place an implant, how will I know that what difficulties the surgeon can face? Because it's really easy for me to say that, you place the implant in the wrong angulation and wrong angle. Now my soft tissue management is very poor and the final restoration is not coming good. Because anytime you already know the final result, that's the time you start seeing things differently. Like the first veneer case we do, we call in the lab tech and we you've done a bad job. And then you go and check with them and the lab, the veneers are looking good. And then you start thinking, should I blame him or would I learn the lab tech work a bit to understand what difficulty they face? So I would have avoided it in the first place. And because I had previously had the max vaccine in my head, I like surgical work. So I was like, implants would be something good to learn. Then the same thing I started learning, started seeing that, which course should I do? Which course should I do? Which course should I do? Which is better? Then I had a chat with, I want to do the University of Melbourne course, implant 2 years diploma. I thought that would be good. But then I had a chat with my principal dentist. Both of them actually, they did the Dan Brenner program. And then they told me that, with Dan, yes, it's not a university qualification, but his knowledge, because he's a prosthodontist, he restores implants as well. He not only places implants. So the best element about his course, what you want to learn, because it aligns with my goal, is you want to not learn about implants. You want to learn the soft tissue management and how to maintain and restore aesthetics for your aesthetic cases with the implant planning. You'd like to learn both. You don't want to learn one. So then I was like, okay, let's talk to Dan. And then I started doing that, and then it led me to the Dan Brenner program. So with me, ortho and Dan Brenner, I did at the same time. And
Wow.
I know that some people might say it's too much, but I felt like with Dan Brenner, you have to go 6 times a year, and boss diploma was online. And I was like, it might work out well. Otherwise, with Dr. V, I had a chat. He said, if you can't finish in 1 year, we can always give you for a small fees extension for 1 more year as well. So if you can't finish, you feel like it's too overwhelming, we'll give you an extension so you can have more time to finish. And then I felt like that puzzle that I was trying to solve, the perio, prosto, implant, ortho, and functional dentistry together, that started to make sense to me. Slowly starts to make sense. In every case, you see that previously we were like, okay, let's do veneers. And then you'd be like, no, we can't do veneers without gum contouring. Or we need some crown lengthening. And I met this amazing clinician, Dr. Hassan Porky. He's in Egypt. He's done his MSc from Germany. He told me one thing, that anytime your patient says no through your treatment, that's the case you fail to plan. Because tomorrow, if someone tells you that, you have problem in your kidney, you're not going to think twice. You will say, how much money do you need? When can I come to the hospital? I'm going to drop everything. And it's a good example, because anytime we start explaining them how important your teeth health and your impact on the oral health is, they actually don't say no. You're just explaining them that I can tell you when we finish the case, it's going to look really ugly because half of your gums will be visible, half will be not. And then you'll be coming back telling me that, they're looking white, but you don't like it. And that's what comes with experience. You keep telling patients that this is something that, we need to see. So that's what I felt like, after getting a bit of the puzzles getting solved, then you do that. At the same time, what I requested my principal dentist, this is after 2.5 years, that can I please get 10 minutes every 2 weeks, if you can. Some weeks he's busy, some weeks he's not, but then I was trying my best. And the days he was not available, I did the same day. I take photos like crazy, like so many photos. Half of the time, my assistants get really fed up that, this guy's what he's doing. But
It's doing photography.
All those photos on a Sunday, that's my favorite activity. Again, on my iPad's open, my laptop's open, my phone's open. And then I'm writing on a paper and drawing sketches on, okay, this is. And then sometimes you don't have to learn from anyone. You just look at it. You just sit down, take 10 minutes, look at it. And most of the time, I can solve the case just by looking at it. And I can tell, okay, this is not going to work. This is not. I think majority of the time, the problem is when we're looking at clinically, we're not focusing. We're focusing at one point so much, we miss out the picture. Like when we're doing crown preps, I always tell my students, and I did that for myself as well, do a crown prep, don't make a provisional crown straight away after. Take a 5-minute break, go out, have a coffee, go for a walk, come back, you will see 12 mistakes in your crown prep. And why is this happen? Because so many other factors involved when we are doing, and, we're talking to the patient, the stress, and someone's already waiting in the reception room, and, your assistant turned up late, so now she's preparing your side room as well. We miss out on things. And if you study neuroscience, when I did my ergonomics and my public health, they say that when you study neuroscience, that's true. That's why they want lectures to be 15 minutes and have a break, because your brain starts creating images. So when you're looking at a veneer and you're doing 3 hours and you're doing a prep, you have already created images where you're not seeing the true reflection of what you should see. So as soon as you do any case, any crown prep, take a 5 minutes break, you relax your patient as well, go out, literally leave the room, use your phone. TikTok is a good way to relax, detox these days. Come back, and then you look at the same case and you feel like you can see that, oh, actually my reduction's less, my margin is good, not good, the undercut's there, and you start seeing things. Same with composite. You take photos and you start to see yourself that my contact was not good, the color doesn't match. Yes, the patient is happy because the patient, mostly the old patients don't complain, but you know yourself that this was not good. But if I didn't take photos, how will I know? I will never be able to know. So if you do that photos thing for 3 years, the amount of learning you get is so much that you already know when people tell you there's a mistake, they're like, yes, I've seen that assessment photos already.
If you like this episode, drop a comment below on your favorite part or leave a review. Don't forget to share it with your friends, and we'll see you in the next episode of CPD Junkie podcast.